plans out by the 5th of August and then submit them, I believe, somewhere in the middle of August. And then what happened at the beginning of this month is that the HERO Act was triggered. So all these plans that have now been submitted had to be triggered and implemented effectively because COVID-19 was considered an infectious disease. And basically what the HERO Act goes over is a number of different items that need to be implemented. The first one, which is the most, probably the most cumbersome one, is that everybody needs to wear face masks when social distancing is not possible. Meaning, if you're in an individual office, you do not have to wear a mask, but if you're sharing an office and you cannot maintain 6 feet of social distance on a continuous basis, you have to wear masks. And the other items are, when possible, and this is like a caveat, when possible, people need to socially distance. So if you have an open office environment and you need your people to be in the office, that means that you cannot socially distance, hence they need to wear masks. So that's kind of how the law, how the current requirements are written. And then there's some other requirements with regards to health screening. So for example, we were coming back into the office already since June of last year, and we had a health screening, which basically means that people need to attest to the fact that they're not having any COVID-19 symptoms, or that they have not been in contact with somebody known to have COVID, or that they have been tested positive for COVID. So that is another requirement that is part of the HERO Act. And then there's some other requirements that I can go over more specifically, but maybe the easiest way for me to do this is to basically send you the requirements that we have and kind of the plan that we have laid out to trigger it.
Yeah, so I can get you up to speed on where we are at with the HERO Act. So we wrote our plan based on the model plan, and we circulated that in late August, before the outbreak was declared. So then when the outbreak was declared, I took the model plan that we had previously circulated and realized that we needed to make some amendments to it, because I was under the assumption that when they declared an outbreak, it would be, more than 2% positive cases in New York City. So I thought it was going to be more like 8%, 10% like it was in the winter. So I wrote it as though, the restrictions that we had in place last winter. So I have revised the plan. I basically took out everything that was not consistent with how we do business. However, there are a few things that are the baseline, the minimum considerations that we have to follow. One of which, the primary one, is face coverings and social distancing because of the layout of our office and because of our space constraints, and because also we have an in-office mandate. If we didn't have an in-office mandate, this would be a little bit of a non-issue, right? Mm-hmm. Because people would and that's how it worked before we called everybody back. Just like about half the people would come in because it was optional. Half the people did come in, half the people didn't come in, so it worked out. But now that we are requiring everyone to come back in, we have too many people to really even pretend that we are socially distancing.
Now Josh, maybe, and Sarah, sorry to interrupt you. Josh, who's going to be policing and enforcing all of these mandates? And I've been reading that there might be some fines, associated with it. But I mean, it's going to be really, really hard for, anybody, I think, to enforce this.
Yeah, no, and I agree with that. And I think, so, but the onus is on the employer, right? So what the New York State has done, they've written the language in such a way that they make the employers responsible for policing and for making sure that that employers are abiding by the HERO Act. Now, what that means in practicality, do we really think that somebody from the health department is going to go up to every single office and check if indeed this is happening? I highly doubt it, but it does put you at risk from an HR perspective in the case that something doesn't happen and it's not being enforced and then somebody gets sick, then you open yourself up to an HR exposure. And that is where we need to be careful with. So from that regards, I mean, there's a training requirement. There's just a requirement that you do everything possible in order to make sure that people abide by those requirements. So I hope that kind of answers your question.
Yeah, well, I mean, I think that the questions that were being circulated yesterday were, is there any provision for vaccinated individuals, which I don't see, because especially since this is a model plan for any outbreak, not necessarily for COVID. It's just that COVID triggered this. So I mean, that's how I'm reading it. I don't know if you have any additional input.
Yeah, we are reading it exactly the same way. There's no provision for vaccination, and this applies to everybody, unfortunately.
Okay. What do you think as far as barriers? So one of the minimum considerations was that you could do physical barriers, because that's an idea that we've been kicking around, because obviously we're fully staffed in here. We don't want to wear masks for 10 hours a day. So we're trying to figure out if there's any workaround to account for the fact that we do not have social distancing in place. So one of the ideas that somebody threw out was to have barriers. I mean, I feel like barriers are pretty passe at this point, because everyone knows that this is airborne. In fact, the HERO Act is based on the fact that it's airborne. Yeah. So do you see any, no? Okay.
No, I mean, we thought about that as well, and specifically at the beginning of the pandemic, because it wasn't so certain that this was an airborne disease. So we thought it was only via droplets. So that way a barrier could protect you from droplets. The answer to this now, if people are sitting less than 6 feet apart, unless there's like a full box that they're sitting in, it is not helpful to put in barrier.
Yeah.
Because it's an airborne disease.
Right. That makes sense to me. Okay.
I mean, and it's one of the things that we're doing in New York is we're implementing agile desks that are sufficiently socially distanced, or individual offices that people can then occupy if they're not being occupied by somebody. So basically they become bookable desks and bookable offices. And that is to provide some relief to people that are in open office spaces that need to wear a mask during the whole day, that they can then at least go to a space for some time. But I'm not sure if that's possible in your current layout. And based on what you said, I probably don't think it is.
Yeah, that's tricky for us because we haven't made the transition to laptops fully. So it's hard for people to change seating in midday. Yeah. Okay. So all right. Is there anything?
So I know for a while, even at our offices, you were supposed to wear masks. And if you were vaccinated, you didn't have to wear masks, even like entering the building.
Yep.
So we're going back to being masked up.
Yes, we are.
And everybody across the city has to do that.
Yes, and it's interesting how the state has done this, because basically the state has taken this responsibility kind of off their chest, even though they're mandating employers to do it. What they've done is they've basically said, okay, the employers make the plans. So since employers are making the plans, even though we're mandating that social distancing and we're mandating masks within that plan, they're basically taking a little bit their hands off it directly, right? So now it's the employers that are requiring us to do this, which is not great.
Yeah, and it's interesting. And Sarah, thanks for bringing this to my attention, because Josh, I don't think we've had as brokers any formal training on this. No. And this is so helpful for me to hear, because this is the first that I've heard of this. I feel like we have to let all of our clients know that they need to be doing this, or there's going to be some sort of liability that they're exposed to.
Yeah, so the training is coming up next week. We have been, Sarah, we've kind of been going through the same exercise of figuring out, like, how can we be as little impactful as possible while still abiding by the requirements? And that has been the ongoing question with our outside counsel. And unfortunately, we have come to the same conclusion as you have, that in open office areas, people need to mask. Social distancing is a requirement, and health screening is another requirement, which is just going to put the onus back on our employees. And it's just not great, because we are building some momentum, and unfortunately that momentum is slowly fading with this.
Right. It feels like a giant step backwards.
Yeah.
And Josh, is there anything else that Sarah should be focusing on that, maybe she's not thinking about, just to kind of facilitate their return back to the office?
I mean, I think it's worthwhile keeping an eye out, because obviously there's a lot of questions going to the Department of Health at this point. We as an organization have put out a lot of clarifying questions out there, just to try to better understand exactly what the implications are. Like, for example, are we allowed to gather? Well, it seems that we're allowed to gather as long as we socially distance, which is kind of a contra, right? There's a counterposition, and also restaurants are open and gatherings are allowed there. So why are they not allowed in offices? So we're asking all those clarifying questions. And I think just continuously going to the website and staying informed of what is possible will hopefully help. And I think that the other thing that you can think about is there's some ambiguity in how this law is written, or how this requirement is written. And that is hopefully a way out in the case that something does happen. So just making sure that you understand what the ambiguity is. For example, you're not allowed to gather, but it's a socially distant when possible.
When possible.
So that's a little bit of an ambiguity.
That's what I picked up on. It's a little bit vague and ambiguous. When is the timing for this to all go into effect, or is this immediate?
Well, this is also it is within reasonable time frame. So you need to implement it within reason. So that's another ambiguous component of the timeline is not clearly established. You should do it as soon as you can, really. That's really the requirement of the current HERO Act.
So one piece of information I found last night when I was doing a deep dive on sort of like the origins of this, because I read on the Department of Labor, I've been informed about this for a couple of months, but when the governor put the designation that COVID-19 was an outbreak on September 6th, then they also said that they're going to review the status as an outbreak on September 30th. Correct. So I guess there's a possibility they may revoke that on September 30th, but it's based on the CDC's transmission levels, which they consider New York State to be high.
Yes.
I don't see that changing. I mean, what's unfortunate about this, honestly, is New York City has much lower transmission rates than the rest of the state. So yes, I think we're kind of getting the raw end of the deal here.
Yeah, no, I agree with that. However, I think that transmission rates will start going up as what has happened last year. I mean, Delta is much more transmissible than the previous COVID strains that we had. And last year, what we saw is that after the summer, we started seeing spikes in New York, and then it basically went all the way up. So it slowly started creeping up. And then in November and December, it started creeping up very fast until we spiked in January and February. My expectation is that the same will happen with Delta. Even though we have got much higher vaccination rates, we still have got a significant percentage of our population that's not vaccinated. So my expectation is that it will go up, and my expectation is that unfortunately they will continue disseminating this as an outbreak.
Okay.
That's also the feeling of our outside counsel and all the metrics that I'm looking at and all the different trends that I'm looking at. And when I'm looking at Israel, for example, it's a good case study where the vaccination rates are very similar to New York with a very similar mix of types of vaccines. They also had outbreaks earlier. But kind of at the same time that we expect them in New York because they started vaccinating rating earlier. So they're basically 3-4 months ahead of the curve when we compare it to New York. So when I put all that data together, my expectation is that we're going to see more outbreaks in New York in the upcoming months.
And so our status with the CDC is not likely to change from high.
No.
Yeah, I know. This is very unfortunate. Okay.
Yeah. I guess as unfortunate as it is, right, because it's a little bit of a burden and there's some heavy lifting involved, I guess, the purpose is well-being of your employees. And God forbid there is another outbreak or another mutation. I guess you want to make sure that you're not liable for that within your workplace. So I guess that's the saving grace there. I wish I would have known about all this sooner. But yeah.
Yeah, so Lance, we're going to be training everybody, and we're going to be sending out documentation around this within the next weeks. We were just trying to figure out some questions.
Yep.
What are you doing for training? Because I haven't gotten that far yet. That's one of the last pieces. Well, besides getting the face coverings, besides getting those approved.
Yeah, this is another interesting part of this. So the training, what we're going to be doing is a 5 to 10 minute session. We were issuing 5 different sessions for the next week. And what we're going to do is all the requirements that are exposed in the plan. So basically explaining what the disease is, how it's being transmitted, how you can mitigate against transmission, and then the specific requirements within saddles that are necessary for employees to follow.
So it's 5 different trainings that are 5 minutes each?
Yeah, I mean, there's 5 different trainings that people can book for, and so we because we have
5 opportunities. Okay,
5 opportunities. We have got 250 employees here in New York that need to go through that training. What is very interesting is that the training needs to be verbal. So it literally, you need to be on a Zoom call. You need to be in a room where you're basically telling this is what is going on, and the verbal component is important. It shall be verbal. That's what it literally says in the.
Yeah, I noticed that.
Yeah.
So that means it can't be a pre-recorded video?
No, it cannot be a pre-recorded video.
Very interesting.
So Sarah, we're going to have guidance on that. I'm going to have the plan ready by the end of this week for the training next week. Let me ask my HR department if I can share that with you, but more than happy to do that. And what we do have is the screen before entering. That is a procedure that we have done with QR codes that might be helpful for you as well. So that's basically a form, and that form has been published in the past, so I can send that over to you as well if that's helpful to you.
Okay, sure. Yeah, especially the training, because that's the last piece for me to get. Yeah, I was gonna write my own, I guess. I don't know. I haven't come across any out of the box, so that would be helpful. Thank you. It's my first pandemic.
Yeah.
Hopefully it's our last one too.
Right.
I don't know if I can do this again.
I know.
It's been a roller coaster. It's been a real roller coaster, unfortunately.
Well, Josh, this was super helpful. Thank you for jumping on the call. Sarah, obviously, if you need anything, feel free to reach out to me directly, or I could link you up with Josh. But Josh is the main man when it comes to this, and he's the best of the best. So anything you need, we're here for you.
All right, great. I really appreciate it. Thank you. And it was a pleasure meeting you, Josh.
Pleasure meeting you.
Thank you.
Bye-bye.
Bye.
All right, bye.